Tablets and spoonfuls. How to manage your gut body. Taking medication while at home. Correctly taking your meds will help your symptoms. Tablets and spoonfuls hosted by Quick Care Pharmacy.
Okay, ladies and gentlemen, welcome to Tablets and Spoonfuls on your radio. Another Wednesday morning, and this is Tablets and Spoonful. Maffa Augustus, Doctor of Medicine Maffa, welcome.
Welcome. Good morning, Felix. How you doing?
Giving thanks.
Amen. And I want to do the same as well, and I want to welcome all our listeners who are tuned in. Good morning to you. Hope the day has begun in a positive way for you.
That's it, and like somebody said, you got life, you gotta be small. Many people didn't make it.
That's true.
So move your hands, your feet. You can see, you can hear, you can talk.
Yes.
Breathing, you are alive.
Yep.
Thanks be to God.
To God be the glory.
We have issues, we have problems, health issues, but thank God, somebody who's got it worse than you.
That is very true. Thank God for the opportunity because there is hope you're still alive.
You know, sometimes people complain. So we need to develop that attitude of thanksgiving,
Yes.
attitude of gratitude.
I agree.
And people complain about certain things, and I know it's hard in so many ways. People have all kind of issues, all kind of problems to deal with, but we do not take time to thank God for the good things that we have.
That we have and what we have not even seen because
And-
it could be worse.
Right. And the good things that we have, if we lose it all of a sudden, we focus on them.
Yeah.
And we complain now.
Mm-hmm.
So why not say thanks for what we have?
That's right.
Thanksgiving gives you a better attitude.
Yes, definitely.
It's good
You
for
think
your health.
it's good for your health, very much so. You approach things differently. You focus, you meditate, and it does help with that level of stress that we complain about everything that's not going our way every
Right,
day.
sometimes we think everything has to go our way.
Yes.
Life never promises that. You know, life can be hard, life can be very difficult. You know, you gotta take it like that sometimes and realize life doesn't owe you anything. You know, sometimes it's hard, sometimes it's bad, sometimes it's good, and you thank God for the good.
Yes, that's
And
right.
the bad, if you have faith in God, He can turn it around for your good.
Amen. That's right. That's right. We have to make it. We have to create the day that we want.
Your attitude, what you say with your mouth.
And
your
that is right.
words,
Yes.
You know, it's so important that you speak life, speak positive,
That is true.
speak victory.
Life and death is in the power of the tongue.
They that love it shall eat the fruits thereof.
That's right.
And even in sickness, whatever you say, it has an effect on you. Because you look at many people, they go to the doctor and the doctor tells them that they have a cancer or something. That's when they begin to die. They had the cancer all the time, or the sickness. By the time they hear that bad news, Words.
They've now made it a fruit
yeah,
of their life. I mean, that's expected, because it's a shock.
yeah, you go
But,
through the normal stages
yes.
of maybe
Trying to actually absorb
yes,
what you just heard.
not accepting it, all of that. Why me? That kind of thing. But you got to come to the point where you say, well, I'm going to turn it around by faith. I'm going to do the best with what I have. I'm
That's
going
right.
to be the best person I can be in this situation.
In this situation, yes.
I'm going to fight and give God a chance. If you don't
I
fight, God
agree.
will not help you.
That is right.
If you give up, that's it.
That's
You're left
it.
to mourn.
Yes.
But if you stand up and you fight, it will be different. According to your faith, be done unto you.
Powerful, Felix. Powerful.
And so this is Tablets and Spoonfuls on your radio, a production of Quick Care Pharmacy. We want to say special welcome to all our listeners wherever you are, near and far. Those of you listening overseas, great to have you. The number to call is 440-8600. Thank you for your comments. Thank you for
The encouragement.
the encouragement.
Yes.
Right.
And the appreciation for the program. We thank you for that. Because we are
Mm.
motivated based on that to come to you every Wednesday and educate you, help
Right.
you manage at home your
Right.
your
We're
drug
learning
therapy.
together how to manage our medication at home properly so you can get maximum results. On today's program, we will talk about something else, of course, something to do with side effects. But hold on, a message first from Quick Care Pharmacy. We'll be right back after a word from our sponsor.
In the plus business, all you see when conducting business is just the hand, the money, and the product. Un petit smile, un petit bonjour, pas parler pour how you doing. But Kote Quick Care Pharmacy at Halsbro, they brought back the care into healthcare because good health is more than just a prescription, more than just a tablet or a spoonful of medicine 3 times a day. Kote Quick Care, you can talk to your pharmacist, panic out your concerns, your fears, your cares in total confidence, and the rest of the staff always ready to help and answer your questions. Mary Sandy Mwe, Kote Quick Care, you can do look your medicine mama and buy. You can expliquer tout le bit about. You can even get your blood pressure and sugar test done right there. So like a panic service, prescription or over-the-counter drugs, count on Quick Care Pharmacy. Kote Halsbro, telephone 440-8600. Chikolodi, there are many reasons why I love Quick Care. But the latest reason is the Black Lion Pillionilla. It's a booster for my rooster.
Okay, ladies and gentlemen, welcome back to Tablets and Spoonfuls on your radio. We want to say special welcome to new listeners, if there are any. We thank you. And of course, we're glad to have you on today's program. Like we said, Martha, we'll be talking about
side effects, trying to give an understanding of what side effect of the drug is. So I want to start off by saying, have you ever experienced a reaction from your medicine that was unexpected? I am sure you have, and a lot of maybe our listeners have as well.
Yeah, you hear people say sometimes, like I feel more malade,
right. Or make me eat a lot, or make me drowsy. Yes. So this is commonly known as a side effect. And so from the homely paracetamol, I say homely paracetamol, to the most sophisticated prescription medicine on the market, all drugs come with side effects. All drugs come with side effects.
But that's a lot of people are afraid of.
No, but food have effect. Yes.
Well, they say more.
But food have side effects.
Well, yes.
Fabrics can have side effects. A type of side effect, which could be an allergy. So it's not only drugs, medicinal drugs, that contain side effects. We also know, and we will see, that even herbal products as well have side effects. So many of the side effects are minor, some are just an inconvenience, a few are serious, and some are just plain strange that you never really expected, because it's a trial and error in any case where drugs, medicinal drugs, whether it's herbal or pharmaceuticals, are concerned.
So you may have a situation where for some unknown reason somebody take a drug and then you have all those pimples on their skin or bumps on their skin, and
it's a type of side effect, and we call that an allergic reaction. That would be an allergic reaction.
For example, I remember taking some medication one time for an infection, and then, like I said, my face got big, swollen like a peanut.
So you had an allergic reaction to the drug. Yes. So perhaps the most common side effects for drugs that work inside our bodies involves the gastrointestinal system. Nearly any drug can cause either nausea or upset stomach. Right? Though it may not always happen, or just probably happen to a handful of people. For drugs used on the skin, you might get some rashes or bumps. This is a common complaint of a side effect for drugs used on skin. Yes.
And in the stomach, of course.
And in the stomach, we have the gastrointestinal, where you feel nauseated, upset, yes, or stomach burning, yes,
or something like that.
Right. So to find out about those side effects, we have to have a discussion either with our pharmacist, our doctor, or even the leaflets, the inserts that sometimes come with the drug. And
but many people do not read those things, though.
Yes, I know. Sometimes it's probably even
better
a little bit.
To read it?
Yes.
Because so much stuff in there, and can be frightening too.
Yes, it can be very frightening. And so that is why, well, in my case, what I do, I try and pinpoint the most possible and higher percentage of a side effect and bring it to the attention of the patient. Because, like we say, all drugs come in for side effects. However, you have different percentages. For example, drug A, while it will cause nausea, dizziness, headache, coughing, whatever, the nausea could be about 80%, an 80% chance of you getting upset, feeling upset. The headache might be 2%.
The quantity, the strength, and everything.
That is very true. So we take that into consideration, because with herbal medicines, there are a lot of chemical metals and stuff that can be found that systemic studies may not have been done on that particular herbal product. And so it could be damaging to the kidney, to the liver, and we don't know. We assume because it's from the soil that it's natural, but it's not.
back to
Yes,
the roots.
right.
And all of that. And again, there's the issue of the amount that we take is natural. So when you're going to point, like meeting the glow show, you know, just take a handful of it
Yes.
and just boil and drink it.
And it could be harmful. So we really have to think of that as well and don't just focus on pharmaceuticals and say they all have side effects. The side effects can differ for each individual depending on the medical condition, a person's age, their weight, the gender, whether they're male, female, ethnicity, whether it's black, white, Hispanic, and other factors can play a role as well. So significant and common side effects, what you find, they're listed or they're mentioned to the patient and the caregivers, like I said. So if you have a drug that more than likely will give you a rash, which we know is a little bit concerning, then we're going to pinpoint that to you. If we know that the drug should not be taken with a particular product because it's going to cause some unwanted side effect, we'll bring that to your attention as well. So those listed potential side
So
effects
you bring that to the attention of the patient.
of the patient, yes.
And I know for a fact before when you went to collect medication, of course times have changed. They just give you medication and will not talk to you.
Yes, I know.
3 times a day before meals and that's it.
Yes, so we know that those things happen, but we're happy for that medium we have right now with tablets and spoonfuls that we can bring that to the attention. We also know that you have the internet, people go on there and get information, but that's like a support and aid in helping you to manage how you're treating yourself. So when the potential side effects of the certain medications have serious consequences, the FDA, which is the Food and Drug Administration, they require that special kind of patient information must be listed either in a guide so that the patient can be provided with the information, right, as to what the symptoms might be, what to expect in case there is an outcome of a side effect.
It never ceases to amaze me when I see they advertise some medication and then they'll give you a whole list of side effects. They are mandated to do that. They have to do it.
You have to do it because you have to let the patient know what it is they're taking and what is the potential risk of taking it. That is why it's not advisable to just go and buy something because you see it or somebody told you they've used it. Not even if you come and talk to the pharmacist that you should just go to the pharmacy and just take something over the counter. It is good to have a discussion. You speak to your doctor can better evaluate you if you're hypertensive, you're diabetic, if you have other complications. So along with that, it's a team affair. Your doctor work with your pharmacist and they work with the patient, and so we can better guide you as to what it is that would be best for your condition because it's specific to you. As I said, the side effects